Dr. Hefner, I was wondering a little bit if you could talk about people's career paths in these different roles, and specifically, I guess I didn't brief this in the questions, but something that is very that people are very interested in all the time is kind of compensation, and we can talk about that in general, but or even like if you could share kind of like what might that look like the compensation path and the career path for these different roles.
Yeah, absolutely. So I would say to people to look geographically at their areas and start to reach out to people and, try to get a sense of course, there are definitely salary benchmark studies out there and published materials on salary benchmarks across different geographical regions. So that's a great place to start to kind of get a sense of negotiations for job offers, and then not being afraid to ask what the range is for the role. Often employers will have a range in mind, and realizing that if you have prior healthcare experience, not to discount that and to bring that into salary negotiations. And so there really is a wide range of salary expectations for medical assistants in today's environment. So knowing what your location and area kind of supports, what the demand is within the different areas, getting on sites like Indeed and Glassdoor, all of those kind of offer a chance to see how many opportunities there are in your area. But, salary is higher than it was certainly years ago. Of course, costs are higher right now too. So I think it's in knowing where the benchmark kind of is for the starting and ending range within your area. And like I said, just using those salary guidelines that are published online is a good place to start to do that.
And Dr. Hefner, I was wondering, just curious, like throughout your career, maybe through others, have you seen people like kind of negotiate their salaries? Is that something that happens frequently?
Absolutely. Certainly, like I said, when you go for a job interview, might not be the time to ask directly about salary, but at job offer, certainly asking, is that your best offer given my, and list why you think you would be worth a higher offer. If you're new to the area, given my strong organizational skills and my customer service, perhaps drawing from a different job, and pulling that in and saying I would be willing to renegotiate in 90 days after my first performance review, and kind of setting up that expectation with your employer that they'll give a 90-day performance review is very helpful and is a really good time to look at salary negotiations as well, especially if you're just starting out. You may be eager to accept that first offer, and so if you do, having that 90-day expectation kind of looks good for the employer too. It gives them a chance to really go over with you what they've seen for performance in those 90 days.
And maybe because Dr. Hefner, we've had guests on here who've described like their own personal performance reviews. I'm not asking you for that, but if there's, what are the things that a medical assistant throughout their career, what are they usually evaluated on?
Yeah, absolutely. Uh, Always we're going to have customer service is a portion of our evaluations. Uh, Clinical knowledge is kind of an expected thing, but we do expect growth. For me personally, when I sit in on a medical assistant evaluation, because I'm also a practitioner, and so now I work with medical assistants and help with those evaluations. And so we're looking for growth. We're looking for performance to metrics. So, for example, did we run on time? Were patients checked in and testing done on time? How accurate was your documentation is one of the areas that we look at for performance evaluations. Overall, feedback from patients weighs in. And so both good and bad, we're seeing some patients, sometimes we're seeing them at the worst points in their life. And so having a caring, compassionate conversation with patients can make all of the difference. And patients share that with providers when providers walk in the room. And so, we write those down. in my practice, we if I hear very good things, if I have a little bit of a negative feedback from a patient, I go directly to my medical assistant and share that with them and let them know kind of what things were noted and how I see that we could rephrase things and improve. And taking that feedback is a portion of our evaluation. How our medical assistants respond to that feedback is a very important item that we look at to see in that next similar situation, how did they perform then? And did they take that feedback and really use it to improve across time? And so improvement in performance is a big thing that we use in our evaluations.
Dr. Hefner, this has been super helpful. We've covered all the gamuts, I think, of the career path and different compensation and all these different things that I think people are looking for. I'd love to hear your take on, we kind of crossed on it a little bit, but just to put it out there, like, what kind of certifications do you think are needed today in order to get like a medical assistant career or for a broader allied health career? I'd just love to hear your opinion because I think you've been involved in. It seems like you've got a few and you've been
I
involved in
do have a few.
educating on the few. So just curious to hear your take.
Absolutely. So for medical assistants, the CCMA offered through the National Health Career Association, that's a respected credential. Basic life support and first aid, of course, are going to be expected in addition to the CCMA. But patient care technician, phlebotomy technician, I personally hold certified professional coder, certified professional biller, and certified practice manager through the AAPC. Uh, in addition, things like the National Institute for Stroke, they offer certifications. I hold a Stop the Bleed certification, which is a specific orthopedic certification for like active shooter things, major weather events, things like that, that are focused on stopping traumatic bleeds. So that is one that can be found within basic life support. There's advanced cardiac life support, there's pediatric advanced life support. And so there are really no end to the certifications that are offered. What I will say when it comes to certifications is to do your due diligence when you are looking to get certified. Look at the professional organization, the cost of certification, the cost of maintaining certification, and that return on investment.
I think that's a really wise approach to take, just balancing that cost benefit. So I was wondering a little bit, what skills are important to teach and to maintain in a clinical setting? We might have covered it a little bit, but just like putting that all together as a nurse educator.
So there are within the curriculum for medical assisting, Springboard has broken it up into a series of weeks to help cover those needed clinical skills. They include, sorry, I'm pulling it up here in front of me. I just want to make sure that I'm reading infection control and safety. Phlebotomy is included to a portion, EKG and cardiovascular testing. Within the medical assistant clinical tasks, there are checklists that will be used. So students will have the opportunity to have a clinical checklist with the skills available to them. And one of my best pieces of advice would be to practice those checklists until you know them in and out, until it's muscle memory almost. The brain is muscle. And so using it for that muscle memory development has been integral to my own education. Teaching, I call it teach the dog. You can teach a cat, you can teach goldfish, I don't care who you teach, but taking those checklists and teaching them, make sure that you know that information. There is nothing like solidifying information than to get in front of somebody and have to go to teach it. The first time that I had to teach blood flow through the heart, I knew it like the back of my hand. But teaching it is different. And so I can guarantee you that my spouse and my children also did learn the blood flow through the heart before I had to go and teach it to students for the first time. And so using that approach as a student is a huge benefit.
And I could totally see that the teaching is to learn, and you kind of consulted your own learning. And glad to hear also that your immediate family knows some of the skill sets and and things that you're working on. So, Dr. Hefner, this has been amazing. We've spent a lot of time going over all this valuable material. I'm wondering now, we're gonna take us home now, and if you had any just final words and anything that you want to share with anybody who is trying to get on that journey to starting their medical career or becoming a medical assistant.
Absolutely. I would tell them you matter. Choosing a career in healthcare is both challenging and deeply rewarding. It's a chance to truly make a difference in people's lives. And there will be tough days when you question your path or feel overwhelmed. Staying organized, compassionate, and open to learning helps really bring clarity to those moments of why you chose this journey. Professionalism, a commitment to continuous growth will set you apart and open doors that you may not, like I said earlier, may not even know that they exist yet. I cannot tell you how many times in my own journey I had no idea where this all was going. Stay connected with colleagues and with professional organizations. Your dedication can lead to opportunities that you haven't even yet imagined, and just keep going. Your impact matters more than you realize, and we need all the members of the healthcare team that we can get.
Well, if you've been listening, we've been covering a lot of different topics from the day to day to compensation to, advice. And I think that's a great note to end on, Dr. Hefner, which is that you, dear listener, do matter, and that joining a medical field, starting a medical career, super challenging, but super rewarding. Well, thank you.
Thank you.